Hi, I'm Dr. Svetlana Dani, and this is the Upside Down Doc podcast. And today I'm going to take you on a journey of what we used to think of muscle versus what we now know of muscle. Okay, so when you think of muscle mass, what do you think about? You think about aesthetics, you think about strength, you think about the way that you look in a swimsuit, perhaps. That is exactly what we've thought about muscle for years. It's a rope and pulley system. It is a meat cable that just moves your bones around. But we now know that that is no longer the case, okay? Now we know that muscle is so much more than that. Muscle is the largest endocrine organ in your body. And what does that mean? That means that muscle secretes something called myokines. Myokines are endocrine factors that talk to itself. So it has autocrine function, means that it talks to itself. That has paracrine function, talks to the organs close to the muscle, and also has endocrine function. And the endocrine function means it talks to organs that are pretty far away. This is really the paradigm shift that I want you to sit with today. That muscle is not just for aesthetics. Muscle should be in the same conversation as your pancreas, as your thyroid. It's amazing. So muscle releases something called myokines, most of which are peptides or small proteins. And those peptides can then get into different tissues and signal different tissues to adapt to exercise. You have a muscle contraction. These myokines are released, and then they act like a pharmacy all over the body. So the one that I really want to focus on today is called IL-6. Okay, now normally we hear about IL-6 in the context of inflammation. It's an inflammatory marker. And actually your adipose or your fat cells will release IL-6 in kind of a slow and steady fashion, and that creates inflammation and just all sorts of bad things around the body. Exercise also releases IL-6, but it's a high spike of IL-6 as opposed to a constant low level release from adipose tissue on a regular basis. And that makes all the difference. So think of it as slow release of IL-6 from your adipose tissue is kind of like a slow burning dumpster fire that's just sitting in your backyard and poisoning the atmosphere. The release of IL-6 when your muscle contracts is more akin to a controlled burning of a portion of a forest to actually help with fire control. And that's the big difference. And so that spike leads to so many changes, which I'm about to go into. So the spike of IL-6 has some pretty amazing effects. When the IL-6 spikes, it affects muscle and it increases muscle mass. So it increases and helps with muscle hypertrophy. At the same time, as opposed to the slow release of IL-6, which is inflammatory, the spike of IL-6 that's associated with muscle contraction is actually anti-inflammatory. It helps with fat oxidation, so using your fat. It helps with thermoregulation. And if you're a diabetic, it can really help with glucose control. Acts just like a pharmacy. And this is actually my favorite effect of IL-6. So when IL-6 is released as a result of muscle contraction, that IL-6 will then travel to the pancreas and it'll travel to the intestinal cells. And in both the intestinal cells and in the pancreas cells, it actually helps release GLP-1. The GLP-1 that we pay thousands of dollars for to enhance weight loss. Isn't that amazing? You exercise, you have muscle contraction, and then there's natural GLP-1 that's released. And now there are studies that show that if you're trying to lose weight, the natural release of GLP-1, it works best when also coupled with pharmaceutical GLP-1s, but the fact that your body does this and releases GLP-1 all on its own is just amazing. I love that. The other two functions of myokines that are truly fascinating is with muscle contraction, there are myokines that are released that will then travel to the brain and in the brain cause transcription of a factor called BDNF. And BDNF is known to be neuroprotective. And now we have studies that show that it protects the brain from Alzheimer's disease, from Parkinson's disease. And if there's anything that you can take that protects you from Alzheimer's or Parkinson's, wouldn't you take it? Isn't that amazing? The next, and this is something that I think we should apply every single day. We use lots and lots of anti-aging skin serums and lotions, and we don't really know which ones are working, which ones are not working. But muscle contraction will release a myokine called IL-15, and IL-15 can actually slow down skin aging. The thing that I really want you to take away from this episode is that exercise is not just for looks, it's not just for aesthetics, it's not just for strength. It is literally a pharmacy that lives inside your body that affects every single organ as you contract your muscles. And the effects are fascinating, and we're still learning about them. And the thing that I really want you to think about is, in the future, if we can harness a certain type of exercise to produce a certain kind of effect. After we study these myokines, if we can isolate and prescribe a specific kind of movement for a specific kind of effect, for an increase in thermoregulation, or for an increase in fat oxidation, or for an increase in brain protective effects, wouldn't that be wonderful? And also, another thing that I really want you to think about is just, let's reframe our idea of exercise, right? Exercise is not just calories in and calories out. When you contract your muscles, that's an entire system that you're activating, and the downstream effects are endless. There are effects on your skin, on your brain, on the muscle itself, on your fat, on your pancreas, on your heart tissue, on your stomach lining, everything. There are 3 points that I really want you to take away from this podcast. The first one is that exercise is really uncomfortable. It's hard to get started. It's hard to wake up in the morning. It is hard to take that first rep. The discomfort is real. But if you think about what's on the other side of that discomfort, if you just keep moving 1 rep at a time, or if you're running or cycling, it's 1 step at a time, 1 push, 1 pedal push at a time. If you just think of it that way, think of what's on the other side. You're opening up an entire world that would otherwise only be available to you with polypharmacy, if even that. The second point that I really want you to take away from this is to not treat exercise as a way to look a certain way, or at least not only to look a certain way. There's nothing wrong with trying to use exercise to look a certain way, and that's completely fine. But it is so much more than that. Exercise gives you so many downstream effects. It affects your brain, your heart, your muscle tissue, that to only think of it as a way to look a certain way is just so limiting that I really advise you against that. And I really want you to think of it almost as like a dose of medication. And the third thing that I really want you to take away from this is try to make exercise regular, not occasional. When you make it regular, the benefits really accumulate. It's almost like putting money into an investment account. The more you do it, the more often you do it, the more the effects really build on each other and compound. And honestly, the easier it gets. And it doesn't have to be anything major. It can just be a few movements once a day. And it doesn't take much. And actually, now we have studies that show that you only need as much as 3 or 4 minutes of intense exercise for all of these physiological changes to happen. That's not much, 3 to 4 minutes. And in future podcasts, I'm going to get into exactly what to do during those 3 to 4 minutes. But for now, we're done. Thank you so much for joining me. I really appreciate it. And if you have any questions, please DM me, send me a message. You can find me on Instagram and TikTok as the Upside Down Doc. And I will see you next time. Bye.